In this video, we'll be looking at kidney stones. So if you want to learn more about kidney stones, what are kidney stones, what causes them, so on and so forth, you can watch this video to find out more. So we'll be covering things from presentation, meaning that when someone has a kidney stone, what symptoms do they have, what complaints do they normally complain of. We'll be looking at two types of kidney stones in this video because this is part one, and we'll also be looking at what causes them and the treatment. So let's start with presentation. When someone has a kidney stone, they usually have unilateral flank pain. So you have your right flank and you have your left flank. Unilateral means one side, bilateral means two sides. So unilateral flank pain, only one flank is hurting. Is it at the right or the left, but not both? And you have the complaint of they might have hematuria, which means blood in the urine. So the urine might appear red or pink, and also colicky abdominal pain, meaning crampy abdominal pain that comes and goes in waves. And if the stone is big enough where it causes obstruction, they might have pain on urination, and you will also feel like their private part is hurting, maybe for the males. Those are the presentations. And before we actually get into the two types of kidney stones, I'm going to briefly touch on a general treatment. So, persons, as a preventative for kidney stones, persons are encouraged to drink enough water. And also for treatment, if the kidney stone is small enough, they are encouraged to drink more water because in drinking water, if the stone is small, it can just be flushed out in urine. They can just pee out the stone. So let's now talk about why water can be used as a preventative for kidney stones. But let's first start with how urine how urine is made. And I don't know if you don't know this or if you didn't know this, actually comment and let me know. So your urine is actually formed from your blood, and let's talk about it. So the urine is made in the nephron of the kidney, that is functional unit of the kidney, and the kidney has a filter. We call that filter the glomerulus. You know, for example, if you're making juice, say that you blended the juice, and you have the actual water and you have the trash, what remained from the blending, and you strain it. And if you notice, when you strain the juice passes through the strainer, and then the trash stays behind because it's too big. So what happens is that when the blood goes to the filter of the kidney known as the glomerulus, only the small things pass through. Bigger things like proteins and so don't pass through. The proteins also don't pass through for a different reason as well, because the basement membrane of the kidney has a negative charge. Proteins have a negative charge, so negative charge repel. But I think also proteins are too big, so they can't pass through. So my main point is saying that the kidney has a filter. So when the blood gets there, the glomerulus only allows certain things to pass through to continue its journey down the nephron. So okay, after we filtered, we leave the big stuff behind and we filter what passes through. When the rest of that is passing along the nephron, this is what the body does. It's going to pull back some things like your electrolytes and so forth. So it's going to reabsorb back some things from that. And as it keeps going along, what the body has in excess, it's not going to take it back. And waste, it's not going to take back waste. So that continues traveling along the nephron until it gets to the collecting duct. Then it goes by the way, so that is called the urine basically. So remember that we have the filter or the glomerulus, the big things stay behind, small things continue along down the nephron, and from those things that continue along, we pull back what we want, called reabsorption, and what is not reabsorbed basically forms the urine. So as the urine travels along the kidney, it gets, or the nephron specifically, it gets to the collecting duct, and from the collecting duct, it goes to the renal calyces, the renal pelvis, the ureter, then to the bladder, and from the bladder to the urethra, and then you pee it out. So what happens now is that stones, kidney stones specifically, form in the renal calyces or the renal pelvis. And from forming in those areas, then it can also move to the ureter and cause obstruction. So what happens now is that calcium and oxalate, this is just an example, can combine. And when they combine, they form crystal. And so those crystals now, so for example, you have one calcium oxalate crystal, another calcium oxalate crystal, they can combine together, clump together, and that's how we have stones clumping, stones forming, sorry. And what happens is that this has a higher chance of happening when the urine is concentrated. When that urine that is traveling along the nephron, when it's too concentrated, mean that it doesn't have enough water. That's how we have a higher chance of kidney stone, which is why persons are encouraged to drink enough water. Because when the urine is dilute enough, we have a lesser chance of forming kidney stone. That doesn't mean you should go and over drink too much water. Too much of anything is not good. That is why persons are encouraged to drink more water. First type of stone we're going to look at is calcium oxalate kidney stone. This is the most common type of kidney stone. So when somebody has a kidney stone, that one is suspected first. But it depends, because if the person has a history of UTIs, or has a current UTI, or maybe a long-standing UTI, then we may suspect another kidney stone, which we'll get into. So there are more than one causes for calcium oxalate kidney stone. Can be caused by vitamin C overuse. It can be caused by ingesting, swallowing ethylene glycol, or in gastrointestinal disorders where there is malabsorption, difficulty absorbing. For example, in Crohn's disease, where there is difficulty absorbing fat. And also, I almost forgot this one. Calcium oxalate kidney stones can be caused by is it hypositrate? Hypositrate urea, low citrate in the urine, can be caused by low citrate, and I'm going to explain this one specifically. So, calcium oxalate kidney stone, as the name implies, is when calcium binds to oxalate. So, this is what happens when we have citrate in the body, citrate in the urine, and we discussed the whole urine thing earlier. So, citrate in the urine binds to calcium, and when it binds to calcium, it doesn't form any stone. You can just pee it out normal. That's a normal thing for the body. But when there is low citrate, calcium is free in the urine. It's just there saying I'm available. So when the oxalate sees the calcium, they can bind together and they form crystals which clump together and form stone. So the more citrate that we have binding to calcium, the oxalate cannot bind. For example, if I go on the bus and I sit in the seat, I'm in the seat. Nobody can sit in the seat because I'm already there. So when the citrate binds to the calcium, the oxalate cannot bind to increase the chances of forming stones. So that's why low citrate can cause calcium oxalate kidney stones, and this is why citrate is one of the treatments for calcium oxalate kidney stone. Other treatments include thiazide. Thiazide is a diuretic, which basically diuretics increase urination. So I'm guessing that if the stone is small enough, then they take that diuretic, they pee more to help pass out the stone. And also a low sodium diet, that's the next thing. So I'm going to explain how a low sodium diet can help with treating calcium oxalate kidney stones. So we eat sodium from we get sodium from the food that we eat, and we know we get sodium from salt. So back to the kidneys now. In the kidneys, when we reabsorb sodium, we reabsorb calcium. It's linked together. So the more we reabsorb sodium, the more we reabsorb calcium. And also, the more we excrete sodium, the more sodium goes with the urine, goes into the urine to be excreted, the more we excrete calcium. This is what happens now. So the more sodium you take into the body, when it reaches a point where the body has too much sodium, it's not going to keep reabsorbing because it already has enough. It's going to start excreting sodium, and the more sodium that is being excreted, meaning that it's not being reabsorbed back into the body, it's going to be a part of the urine that is excreted. The more sodium that you take in, once it reaches a point where the body has enough in the body, where there's enough in the body, we're going to start excreting because we have excess. Once we excrete more sodium, we start excreting more calcium. And what happens? There's more calcium in the urine. When there's too much calcium in the urine, then it has a more likely chance to bind with oxalate to form calcium oxalate kidney stones. So that's why a low sodium diet is recommended for treating calcium oxalate kidney stone. And when the urine is examined, the crystals for calcium oxalate kidney stones have an envelope or dumbbell appearance. And a picture should pop up so you guys can look and see how it appears. The next stone that we're going to look at is the AMP stone. ammonium magnesium phosphate stone, and it is also called the struvite stone. And this one is pretty interesting. This one is seen in persons who have UTI, urinary tract infection. And for UTIs, by the way, you can also check me out on Instagram, MD in the making, because I also make these videos on my Instagram. I have a previous video on UTI specifically as well. There are two types of UTI. We have a lower UTI that affects the urethra and the bladder, and when it ascends, it can cause an upper UTI and affect the kidneys, and we call that upper UTI pyelonephritis. So back to this now. Ammonium, magnesium phosphate stones are seen in persons with UTI, and this is what happens. It is seen in persons specifically with UTI caused by urease, bacteria that have urease. And this is what happens. So bacteria with urease like Staphylococcus, Saprophyticus, or Proteus, or Klebsiella, that urease breaks down urea to form carbon dioxide and ammonia, and ammonia is alkaline. So this is what happens. So the bacteria can get into the urethra and ascend to the bladder, and it can get to the kidneys. And when it get into the kidneys and gets into the part where the urine is, remember that it breaks down urea to form carbon dioxide and ammonia. There's going to be more ammonia in the urine. The urine is going to become more alkaline. And when there's a lot of ammonia in the urine and it's more alkaline, it increases the chances of ammonia, magnesium, and phosphate forming crystals and clumping together to form stones. And when we examine the urine, what we see is coffin shape. So we see coffin shaped crystals, and treatment for this type of stone is treating the underlying infection. So if we know that it is caused by those organisms that have urease that breaks down urea to carbon dioxide and ammonia, then we can treat the underlying infection. So this is part one, and I hope you guys stay tuned for part two, and I hope this was very informative. Thank you for watching.